discussing regarding the different types of lifestyle disease, and we were also discussing what are the major reasons for lifestyle disease. And today we will see one important type of lifestyle disease which is commonly affecting people in India and also in our state, that is a diabetes. So diabetes is scientifically known by the name diabetes mellitus, because there are two types of diabetes. One is diabetes insipidus. Insipidus is a different form of diabetes, and here it is a diabetes mellitus, and commonly we use the term diabetes. Now it is basically a metabolic disorder. Metabolic disease means it is not caused by any bacteria or any virus or any other microorganism. It is simply because of the wrong functioning or malfunctioning of our own body system. And that kind of disease are known by the name metabolic diseases, in which the person has a high blood sugar. And by blood sugar we normally refer to glucose, because glucose is the nutrient that is giving us energy for various activities which are performed by our body. So what happens in the case of this diabetes is that there will be high level of sugar in the blood. So that is the typical symptom of diabetes. That is why when people are having diabetes, they routinely go to a clinic and check their blood for the presence of diabetes. Normally it should be below 100. So that is the 100 milligram per 100 ml. That is the amount of glucose that is permitted. And if this amount is above that level, we can think that our body is not working properly and there is a possibility of diabetes. And if diabetes is there, there will be too much sugar in our blood. And that too much sugar is remaining in our blood means very little sugar is available for other body cells of the body. So blood sugar that our body is mainly producing, or glucose that is produced by our body during our digestion, is simply remaining in our blood, not entering into our blood, our body cells. So body cells will not be getting enough energy, and that will be another complication of diabetes. So here you can see that in case of diabetes, the person will be having high blood sugar, and there is a reason for presence of high blood sugar. In our body, there is a hormone known by the name insulin. Insulin is actually a hormone produced by pancreas. Pancreas is a small gland present in our stomach, in our abdominal cavity. There is a small gland. And one part of that gland called by the name islets of Langerhans. Pancreas is the entire gland, and one part of that gland is known by the name islets of Langerhans. And that part is producing a hormone known by the name insulin. And function of this insulin is that insulin is a hormone that has a capacity of converting our glucose present in our blood into another product known by the name glycogen. So normally if insulin is present in our body in sufficient quantity, our body will be converting this insulin in our blood into glycogen. So and glycogen can be stored in our body in various parts of our body, like liver or in muscle. So this process is not taking place. So in a diabetes, what is happening is that our body may not be producing sufficient quantity of insulin, and as a result what happens is that this conversion of insulin into glycogen, which is normally taking place in our body, may not be taking place. And as a result what happens is that all the glucose which are produced by our stomach during the digestion will be remaining in the blood itself. So the blood will be having too much amount of glucose. At the same time what happens is that our body cells are not getting this glucose for its daily activities. So this is the problem of diabetes. So the body does not produce enough insulin, and because cells do not respond to insulin that is produced. So in 2000, the WHO states that at least 171 million people worldwide suffer from diabetes. That is 2.8% of the world population is suffering from some kind of some form of diabetes. So that is nearly 3% worldwide. But if you take the data in Kerala or in India, it is more than 10% of our population are suffering from diabetes. You may not be aware that at least one person in your family or in most of the families in Kerala are having a diabetes. At least one member in your family may be experiencing diabetes. So on an average, it is not less than anyway between 10 to 20% of our population may be suffering from diabetes. So it is a very common disease in India. And sometimes doctors say that India is the diabetic capital of the world. So because the number of diabetic people in India is increasing every year, there are different reasons for that. Because India is developing, and when a country is developing, people have more money, they will be consuming more of nutritious, nutrient-rich food, and that will be increasing their body weight. And at the same time, people will not be engaging in too much physical work also. So this will all contribute to formation or development of diabetes. So on an average, that nearly 3% of the world population is suffering from diabetes. Its incidence is increasing rapidly, and it is estimated that by 2030, this number will almost double. That is, there is a world average, and diabetes mellitus occurs throughout the world, but is more common in developed countries. Now, if you go to America, you can see that most of the people there are very fat or very obese. The reason is that people there are consuming too much nutrient-rich food, mainly meat or other kinds of meat products, or milk or dairy products, or chocolates, and also alcohol. All these are too much energy-giving food. So when you are eating too much nutrient-rich food, that will be increasing your body weight. So that is a problem faced by people in America. But if you go to Europe, I don't see so much obese people, but mainly in America and Canada, most of the people are obese. Now, so that is a problem. Obesity is increasing, and when obesity is increasing, that itself will lead to the development of a lot of other problems like back pain, because our body will be having more weight than our skeletal system can support, or our backbone can support. So that will be putting an extra burden or extra stress on our backbone, which will be leading to back pain. And there are a lot of other complications also. So great increase in prevalence of diabetes is expected to occur in Asia and Africa. So you know that most of the countries in Asia are going through a rapid phase of economic development. You know what is happening in our own country. Now India used to be a poor country for a long time. Now India is also developing, and today we are we are going to be the third most in terms of economical power. We will be having the third largest GDP very soon. Now it is fourth. So that way India is increasing its economical capacity. That will be also reflecting in the purchasing power and also the food intake of the people. So that is and this is also happening in Africa. Many countries in Africa, like Nigeria is the most highly developed economy in Africa, and similarly many countries in southern Africa are developing. So there also this kind of problem of lifestyle disease is increasing. So Asia and Africa, that is why the WHO is giving this projection in this present decade, the number of people affected by diabetes in both Asia as well as Africa will be increasing. That increase in incidence of diabetes in developing countries follow the trend of urbanization and lifestyle changes. So what is urbanization and what is a rural way of life? Normally when people are in a village or in a rural background, most of the time they may be engaging in some kind of agricultural work or agricultural activity, and that will be giving them a lot of physical exercise. And most of the time the people living in a village or in a rural setup will be mostly eating some kind of food which are available in their land or in their place. They are not going to purchase nutritious or nutrient rich food which are normally available in the supermarket. So when people are living in a rural background, they are taking care of their health to a good extent. But when people are moving to urban area or a city like area, now if you take the case of Kerala, 47% of the people in Kerala are living in a urban setup, or 47% of Kerala is considered as urbanized. So that is the case in Kerala. Then if you go to Bangalore or Karnataka, you can immediately understand that the city of Bangalore is highly developed. But if you move away from the city of Bangalore, you can see that there is no development in many parts of the Karnataka. That is the case in Tamil Nadu also. So that is not how things are in Kerala. In Kerala, most areas are highly developed, and that is also reflecting in the way of life. Whether you are living in a city or in a municipality or in a panchayat area in Kerala, there is not much difference in the lifestyle of the people. So as the urbanization increases, people become there is a tendency of the people to do more office type of work. Now, like a software work, banking type of work, clerical work. When we are engaging in kind of office work, and you might not be getting enough exercise for your body. So if your body is not getting enough exercise, and you are also taking more amount of Western style diet, like if you are eating pizza, burger, or other kinds of like fried rice and chicken, and if you are eating all these products daily, that will be also increasing the amount of fat in your body. Your body will gradually getting obese also. So this is a problem which most of the people or most of the countries are facing when they are getting developed or when their regions are urbanized. So this is why the WHO is saying that by 2030 there will be almost double the number of diabetic people all over the world. Now here you can see what are the common symptoms of diabetes. Now many of them you may be aware of, because one important immediate symptom is that there is frequent urination. There is one problem. The person will be producing more amount of urine, and there will be an urge or a desire to go to pass urine very often. So that is one important problem. Then extreme hunger. Why extreme hunger is becoming a problem? As I told you earlier, there will be a lot of glucose in your body, but this glucose will be remaining in your blood. It is not entering into the body cells. So the cells are not getting enough glucose, so that will be starving, and that starvation of the cells will be sent to your brain, and brain will be giving you a feeling of hunger. So then another problem is that unexplained weight loss. So if a person is having a diabetes, one important way by which it can be easily detected or diagnosed is that the person is some 60 kg and it starts suddenly become 50 kg. That is, there should be, most of the time it will be due to diabetes or some other kind of problem. So and this is happening because body cells are not getting enough glucose and they are starving, and as a result of starvation of body cells, your body weight will gradually decrease. So that is the reason for unexplained weight loss. Now there is another situation known as presence of ketone bodies in the urine, because when you are not eating anything, normally what our body will be doing is that body will be converting the reserve fat or stored fat which are available in your body, and that convert that stored fat into glucose. So this is the norm. So for example, you are not taking anything for 1 week. You will be surviving if you are drinking water. And during such a process like starvation or during a satyagraha or during a case of diabetes, what is happening is that body feels that the person is not eating anything. So it will be converting the stored fat which is present in your muscles or and liver, etc., and that will be converted into glucose and energy will be produced from that. And during this process of converting fat into glucose, certain byproducts like acetone, acetoacetic acid, etc., will be produced, and they are together known by the ketones or ketone bodies, and that will be present in your urine. And the presence of these ketone bodies, especially acetoacetic acid and acetone, will be giving the smell of an acetone. Acetone is the you may be knowing about nail polish remover. That is acetone. So urine will be having the smell of acetone or a nail polish remover, and that situation is known by the name ketonuria. So in that is another problem of this diabetes. So diabetes will be resulting in ketonuria. Then another problem is that fatigue. Fatigue means extreme tiredness. So that because the body feels that you are not eating anything. Then there is blurred vision, because the problem is that diabetes is a disease which is affecting all the systems in your body. Every system in your body will be affected by diabetes. So it will be also affecting your eyes, especially your retina. There is a type of disease known by the name diabetic retinopathy. Now what happens in diabetic retinopathy is that you might be knowing about retina. The inner lining of the eye will be damaged and the person may not be able to see. The person become blind after some time. So that problem is known as a diabetic retinopathy. So in the beginning it will be a blurred vision. Slowly there will be complete blindness and slow healing of sores. Because in some people diabetics may be normal, the blood sugar level is 100. If it is going to 300 or 400, if there is some kind of injury or a wound in your body, the healing process, that may not be taking place. Even after 1 month, 2 months, or sometimes 6 months, the wound will be remaining like that. Every day you have to apply bandage. You can see some such kind of people maybe among your relatives also. So there is another problem is that slow healing of the sores. Then mild high blood pressure. So blood pressure normally is 80 to 120, and if this blood pressure is 100 or 100 and lower level is 100 and higher level is 140 and above, then we call it by the name high blood pressure. In case of diabetes, the blood pressure will be slightly higher than the usual. Then other problems like gum infection in the mouth, then vaginal infection can take place, then urinary bladder infection can take place. All these are due to the excess amount of glucose which are present in your blood. So these are some of the common symptoms which are associated with the diabetes. Then basically we have 3 different types of diabetes. That is type 1 and type 2 diabetes basically. The type 1 diabetes is usually diagnosed in childhood. Many patients are diagnosed when they are older than age 20. In this disease, the body makes little or no insulin. So that is the problem in type 1 diabetes, which is sometimes called as childhood diabetes or insulin dependent diabetes. Now daily injections of insulin are needed. That is why it is also known by the name insulin dependent diabetes, because you have to take insulin every day. So because your body is not producing any insulin. Normally in a childhood or sometimes by the age of 20, most of the people having this kind of problem will be diagnosed. Now why this is happening, nobody knows. But most of the time your heredity or then if there is any family history of someone with type 1 diabetes, there is a high chance that you are also going to get this type 1 diabetes. Then microorganism like a virus. Then there is another problem known as autoimmune problem. That is, our own immune system will be damaging our own pancreatic cells, and in that case also insulin may not be produced. So these are some of the problems which are reasons which are associated with the type 1 diabetes. So that is known as a childhood diabetes. Then we have another type of diabetes, which is the most common type of diabetes, which is type 2 diabetes. It makes up most of the cases of diabetic cases. Now it usually happens in adulthood, because this is a common type of diabetes. What we normally call as diabetes is the type 2 diabetes. Normally happening after a period, after an age of 40 or 50. But young people are increasingly being diagnosed with disease. So that is because of the urban Western style of lifestyle, lack of exercise. All these are leading to this development of diabetes at this early age. Then pancreas does not make enough insulin to keep our body blood glucose level normal, and because the body does not, or there are two reasons. One is that the pancreas in your body may not be producing sufficient amount of insulin. Another problem is that pancreas may be producing enough insulin, but our cells are not responding to the insulin. So that way both can be a source of diabetes. These are the two different types of situations where diabetes are normally developing. Many people with the type 2 diabetes do not know they have it, although it is a seed, because unless you check your blood, you may not be going to aware that you are diabetic. Unless there is some major complications are developing later, you may not be aware that you are having a diabetes. Same is the case of blood pressure. So type 2 diabetes is becoming more common due to increasing obesity and failure to exercise. So these are the two contributing factors. One is when obesity or fat content in your body is increasing, or when you have a less amount of daily exercise, that will be also leading to type 2 diabetes. Now the third type of diabetes is known by the name gestational diabetes. Now gestational diabetes is a high blood glucose that develops at any time during pregnancy. So this is a different type of diabetes which we call by the name gestational diabetes. That is, when a woman is pregnant or having a baby, during that time, some women, not all women, will be developing a case of diabetes. And the problem is that normally this diabetes will be disappearing after the delivery or after the childbirth. But problem is that if a woman develops gestational diabetes during the time of pregnancy, she has a higher chance of developing type 2 diabetes later in her life. So that is the third type of diabetes. So in a nutshell, you can see that there are three types of diabetes. Type 1 is a childhood diabetes, type 2 is an adult diabetes, and third type is a gestational diabetes which is developing during the pregnancy. So this is an idea regarding different type of diabetes which are normally affecting people.